Hello, so this is my complete head-to-toe assessment. Is right now it's 2:51 and it's April 24th. Let me see. Right there, 2:52, Friday, April 24th. So here are my papers. Anything on them? So here's my surroundings. Here's where I'm gonna put my phone. Here are my papers, a pencil. Here's a patient. There's nothing on the bed, nothing on the floor. Over there, not on the ceiling. Here's a Snelling chart. Here's my stuff, like that. I'm gonna put this over here. Okay, so I'm about to start. You see me good again?
Come in.
Hello, Mr. Pea. My name is Armando Farias. Can I get your name and date of birth?
Angel Cepeda, 11/16/99.
Can I confirm it? So I'll make sure the bed is locked. Provide for privacy. Okay, so how old are you?
20.
What is your occupation?
I'm a full-time student.
And where were you born at?
Thompson, Mexico.
Okay, so what brings you into the clinic today?
I have a pain in my knee.
Okay, now tell me about when this pain started, what were you doing, and if the symptoms have changed from when it started till now.
2 days ago, I was running and I tripped and I landed on my knee. And the pain is the same. It hasn't gotten worse.
Okay, what makes the pain better or worse?
Icing it makes it better and running on it makes it worse.
How would you describe your pain? Is it sharp, dual?
It's sharp
Where's the pain located at exactly?
right here.
Has it radiated somewhere else, like down to your leg or something?
No.
What are some of the relief methods you use?
I take ibuprofen and I ice it.
Okay, from a scale of 0 to 10, 0 being no pain, 10 being the worst pain you ever felt, would you grade it?
A 5.
5. Okay, is this pain constant, intermittent? Constant or intermittent as it comes and goes?
Intermittent.
What are you not able to do because of this pain?
I'm not able to go running.
And do you have any other pain I should be aware of?
No.
Okay, then I'm gonna go ahead and take your vital signs. So we're gonna start with your temperature. We did not have a thermometer, so I'm gonna pretend my pencil is a tympanic thermometer. So a normal temperature should be 96.8 to 100.4. You put the probe and you grab the peanut up and out. You put it in. Beep. Okay, so your temperature is 97, which is normal. Now I'm going to take your pulse on your radial side. Pulse should be 60 to 100. Okay, so your pulse is 80. Now I'm going to take your respirations. Obviously, I wouldn't tell the patient that I was taking their respirations, but for the sake of this video, I have to say it. Okay, so her respirations are 14, and it wasn't her respirations were unlabored. She didn't use no any other accessory muscles. Also, she didn't have no tachypnea or bradypnea. So now I'm gonna take her blood pressure, and normal respiration should be between 12 to 20. So now I'm gonna take her blood pressure. I wouldn't do blood pressure on one that has a PICC line, a fistula, a shunt, or an IV. Also, I wouldn't do it on if they had breast or axillary surgery. Blood pressure should be below 120/80. I'm doing the two-step method. I start feeling it at 90. So I'm gonna go up to 120. I should wait a minute. But is your arm okay?
Yeah.
Okay. Then I'm gonna go ahead. I'm gonna find the brachial pulse. Okay. Okay, so your blood pressure is 104/58. So now I'm gonna take your oxygenation. We don't have a pulse ox, but what I would do is if you had nail polish, I would take it off. I would clean the site of the where I'm gonna take the pulse ox, and I'll also clean the pulse ox, and it should be between 95 to 100. So let me see. Beep. So your oxygenation is 97. Okay, ma'am, now I'm gonna ask you some questions. Have you ever had the measles, mumps, or chickenpox?
No.
Have you ever been diagnosed with a heart disease, hypertension, or diabetes?
No.
Are you allergic to any food, medication, or environmental condition?
No.
Can I see that? Okay. Has anyone in your family ever been diagnosed with cancer, diabetes, or high blood pressure?
No.
Okay, now tell me about your parents. Are they still alive? If so, what is their age, and how would you describe their health?
Both of my parents are still alive. My mom's 44 and she's in good health, and my dad is 46 and he's also in good health.
Okay, so how would you what was the last grade you completed?
12.
Okay, now, do you feel like your financial status is adequate for your lifestyle?
Yes.
Okay, do you have any religious practices I should be aware of?
No.
Do you have any self-care behaviors?
I like to exercise in the afternoon, and before bed I like to read a book.
Okay, now tell me about your daily life. What do you do in a normal day?
When I wake up, I eat breakfast and I go to school. And then in the afternoon, I like to work out and eat after I eat lunch. And then at nighttime, I read a book before I go to bed.
Okay, do you smoke tobacco, drink alcohol, or do any street drugs?
I drink alcohol.
Okay, out of the weeks, how many days do you drink alcohol?
3.
And how many drinks do you have in an average drinking day?
I consume 4 8-ounce beers.
Okay, so I will perform the case assessment. So have you ever felt the necessity on cutting down on your drinking?
No.
Have you ever felt annoyed by your drinking?
No.
Do you feel guilty after a night of drinking?
No.
Do you need an eye opener to get the day going?
No.
Okay, ma'am, now so we're gonna do some really personal questions. If you feel uncomfortable or you don't want to answer, please let me know and we'll stop, okay?
Okay.
So in the last 2 weeks, have you felt hopeless, depressed, or down?
No.
Okay, so in the last 2 weeks, have you felt little to no interest in pleasurable things?
Yes.
Okay, so I'll perform the PHQ-9. So, do you feel like life is not worth the living?
No.
Do you have a plan to hurt yourself?
No.
Okay, if this patient is not suicidal, but if she was, I would follow the agency policies and implement like suicidal watch or have someone be with her. Okay, and if she had a spouse or something, I'll tell them to go get me a water so she can answer truthfully to this next question. So, since violence is common in our society, we're required to ask this question. So, do you feel safe at home?
Yes.
Has your partner ever kicked you, slapped you, or hit you in any kind of way?
No.
Okay, so if she would have said yes to these questions, I would have performed the danger assessment, which is just a calendar, and she'll show me the days that she's being abused, and she will describe to me what happened. Okay, now I'm gonna do your mental status. So this patient's body posture is erect. Her body movements are normal, they're not erratic. Her dressing is appropriate to the season. Her hygiene is good. This patient is alert. Her speech is normal. It has a normal pace. It's not slurred or it don't have a fast pace. Okay, now I'm gonna test your cognition. So please answer this question. So what's your name?
Angel.
What time is it?
3.
And where we at right now?
My house.
Okay, so this person is oriented to person, time, and place. Also, I know that her attention span is good because she's not deviating whenever I'm asking her questions or stuff or talking to her. Also, her recent and remote memory are good because she's being able to answer my questions from past history and recent stuff like her knee. Also, this patient makes sense and this patient is not suicidal. So I'm gonna go ahead and take your height, weight, and your waist circumference. So we don't have a scale, but we're just gonna pretend. So please get on the scale right here. So it's 140 pounds. Now would you get back and get all facing that way? So it's 5'5", which would be 65 inches. Uh, 5'5", 65 inches. Now I'm gonna measure her waist circumference, and then this has to be done at the smallest point of the waist. So hers is at 29. So now I'm gonna calculate her BMI. I'm gonna do that over here. So 5'5", 65 inches, 140. Now 140 divided by 2.2 to get in kilograms. So I got 63.6 kilograms, and I said her waist circumference is 29 inches. So now I'm gonna do her BMI, which is 140 over 65 squared times 703. So 65 times 65. So what I got is 23.3. And that's her BMI. Okay, ma'am, would you stand up please for me? So now I'm gonna have you do the standing chart. So it's 20 feet. So 1, 2, 3, 4, 5, 6, 7, 8, 20 feet. So right here. So now what I'm gonna have you do is cover your right eye And now read the smallest line that you can.
LAFODPCT.
Okay, now cover your other eye. Read the smallest line, please.
LAFODPCT.
Okay, so this patient's vision is 20/20. I would know if she was hesitant, if she missed any letters, if she was squinting or leaning forward. Also, if her vision was worse than 20/30, I would refer her to an ophthalmologist. So would you come here, please? So, can you see it clear? Okay, now that you're standing up, we're gonna do some range of motion exercises. So what I'm gonna have you do is just gonna abduct your leg like this. Now you're abducted. Now the other leg. Okay. Now do it like that. So would you turn around? So I see that there's not any curvature of the thoracic or lumbar part, so she don't have no kyphosis or lordosis. Also is symmetric. Now I'm gonna have you bend sideways like this. Now like this. Now I'm gonna grab your hips and then you're gonna twist to the other side. Okay, in this range of motions, what I'm checking for is any pain or crepitus. Also, active range of motion is the patient doing it by themselves, and passive range of motion is me doing it for them. So okay, now I'm gonna have you touch your toes. So this is the spine range of motion. And we can see the curvature right here that I see. So now I'm gonna have you bend your knee. Now extend it. Now bend your knee. Extend it. So now I'm gonna have you do other range of motion. So I'm gonna have you go like this. Do it. Okay. And now put it all the way back. Now touch your scapula. Okay, now put them right here and then go like this. And then touch the back of your head. Okay, so I didn't feel any crepitus. So would you sit down, please, for me? Now, what I wanted, now would you stand up and back again, please? And would you walk and then come back? So by doing this, I can tell that her gait is good. She's not stumbling or anything like that. Also, I want to look for the muscle size and symmetry. I want to know any atrophy, hypertrophy, or asymmetry. So now I'm going to do the elimination part. So what I would document for a stool, it'll be the color, the consistency, if it's like soft, hard, runny, the blood, the amount. And if I couldn't do that, I would ask the patient for the last valve movement. I'll ask them the date, time, and the characteristics of it. Now I'm gonna perform the KES, the functional mobility assessment. So, are you able to bathe yourself without any assistance?
Yes.
Are you able to dress yourself without any assistance?
Yes.
Are you able to get out of your bed or a chair without any assistance?
Yes.
Are you able to go to the toilet and get out the toilet without any assistance?
Yes.
Are you able to perform good control over your bladder?
Yes.
Okay, and are you able to get the food from the plate to your mouth without any assistance?
Yes.
Okay, now I'm gonna have you lay down. So now what I'm gonna do is I'm gonna inspect the abdomen. I will lift her shirt up. So I will shine a light over it. So what I want to look for is striae, and that for the striae I want to look at the color and the size. I want to look for any venous patterns. I want to look at the color of the abdomen also, and if this abdomen is flat, but it can be scaphoid, round, and also the major organs in each quadrant. In the right upper quadrant is the liver. In the left upper quadrant is the stomach. In the right lower quadrant is the appendix. In the left lower quadrant is the sigmoid colon. my bad, it's the right lower quadrant is the appendix and the midline is the bladder. So also I'm gonna see any palpations in the 5 major arteries, which is the aorta artery, the renal artery, the iliac arteries, and the femoral arteries. Also, I'm gonna osculate for any bruit on those areas with a bell. First the aorta, now the renal, now the iliac, now the femoral. Now I'm gonna osculate for vowel sounds in all the quadrants. They can be normal active, hypoactive, and hyperactive, depending. And I'm gonna start on the right lower quadrant. Okay, the right lower quadrant is normal active. The right upper quadrant is normal active. The left upper quadrant is normal active as well. And the left lower quadrant is normal active as well. So what I'm gonna go ahead and do is I'm gonna percuss the abdomen. So and whenever I'm percussing, what I'm looking for is tympani, which is air, and that's the normal. That's what I should want to be hearing. Also, but I can hear any dullness, which can be indicative of adipose tissue, any masses, any fluid, or a distinct bladder. So I'm gonna percuss. Okay, I didn't hear no dullness. So now what I'm gonna do is I'm gonna palpate the abdomen for any tenderness or any distension. So what I'm wanna feel, if there was any of those, I would feel any tenderness, muscle guarding, muscle rigidity, any masses, or any bulging. So I would lightly palpate the abdomen. Do you feel any pain?
No.
Okay, now I would perform the shifting dullness, and this is just to check for ascites. So whenever a person has ascites, you will hear tympani whenever there's supine on their side. So what you want to do is you're gonna percuss from the umbilicus down to the side, and then you will see where you will hear the dullness, and same you will do on the other side as well. So what you would do is you will mark it. Now you will have the patient turn over. This way. And you wanna percuss from the side to the umbilicus, and you wanna see any changes of tympani to dullness. And whenever you hear dullness, you wanna mark it. And same you will do it on the other side. So now I'm gonna perform. Now I'm gonna perform the Idiopsis test, and this is just to check for appendicitis. So I'm gonna have my patient put their leg up, right leg up. I'm sorry, and I'm gonna push here. Do you feel any pain?
No.
Okay. And this is again just to check for any appendicitis. So now that my patient is laying down, I'm gonna go ahead and do the range of motions of the hip. So I'm gonna have you put your leg up. There you go. This is her?
Yeah.
Okay. And again, this is just to check for any pain or crepitus. So now I'm gonna have you. Okay, this is her.
No.
This is her.
No.
Okay. Okay, so now what I'm gonna do is I'm gonna do the foot pedals on my patient's feet. So you're gonna act like you're pumping the gas. Do it again. There you go. Now I'm gonna check the feet and the toes for any lesions or anything like that. Okay, now would you sit down for me, please? Now I'm gonna palpate the shoulders for any masses, for any pain, any tenderness.
No.
Okay. Now I'm gonna have you shrug your shoulders. Now shrug them again. Okay, now what I'm gonna have you do is flex your elbows like this. Now extend them. Now flex your elbows. Now extend them. So okay, now what you wanna do is pronation, so go like this and then like this, and then supination, go like this. So now I'm gonna have you squeeze on my fingers, and this is just to test the strength that is equal. Okay. Okay, now for the wrist, would you flex it like this? Now go like this. Now your fingers go like this, and then up. Now I'm gonna move them. Do you feel any pain, any tenderness?
No.
And then I'm not hearing any crepitus at all. So would you touch your fingers to your... Okay, now on your foot, I'm gonna have you point it to the floor. Okay, now point it to the ceiling. Now point it to the floor again. Now point it to the ceiling. I just did it with resistance. Now what I'm gonna have you do is inversion, so point the sole of your foot inside. Now do it outside. Okay, now I'm gonna check on the kneecap for the alignment to feel any crepitus, and I don't feel any. Now I'm gonna take off my gloves, put new ones. So now what I'm gonna do is I'm gonna feel your hand. I'm sorry, these gloves are hard to put on. So I'm gonna feel your head, and this is to check for any protrusions, any lumps or depressions. Her head is normocephalic, and I don't feel any of the ones I said. Her hair is soft to touch and is equally distributed. Her eyebrows are symmetric to her eyes. Would you take this one off for me, please? Would you close your eyes? Okay, she has complete closure of her eyelids. There's no redness or around the eyelids or the eyelashes, and the eyelashes are evenly distributed. Her eyes are in the socket, so they're not enophthalmos, which means sunken, and exophthalmos, which means protruding out. Now I'm gonna have you look up. Okay, so her sclera is white and her conjunctiva is pink. There's no lesions or any swelling or redness in the conjunctiva and the sclera. Also, the eyeball is moist and glossy. So now what I'm gonna do is I'm gonna check for Perla. So what Perla is, our pupils are equally rounded and reactive to light and accommodation. So I'm first gonna note the size of the pupil, which is a 4, and it's a 4. So now I'm gonna have you look at that object for me, please. I need to take them off. So, okay, it constricts. Okay, it constricts. So now look at the tip of this one, and it constricts. Okay. So now what I'm gonna check is the mouth. So no, wait. Would you smile for me? So her nasolabial folds are equally, and there's no face drooping. Now her lips are pink, and they're moist. Would you smile for me? There's no gum discoloration or any teeth discoloration, and no swelling or lesions on the gums. And then would you say And there's presence of saliva on her tongue. So now what I'm gonna have you do is open your mouth all the way. And this is to test the temporomandibular joint range of motion. Now close it, partially close it. Now put it out, your jawline. Now move it side to side. Now put it out. Now put it back in, open it. Okay, now I'm gonna have you look to this side. Okay, now look to this side. Now open your mouth. Okay. Now what I'm gonna do is I'm gonna test some part of your neuron. So what I'm gonna have my patient is with this paper, I'm gonna touch certain part of her faces, and she'll say now whenever she feels it. Okay, so now I'm gonna test her smell. So what I'm gonna do is with this, I'm gonna tell my patient to occlude one nostril, and she's gonna tell me when she smells it and what is it. Oh, okay. The other, occlude the other one. Okay, so. Now would you puff your cheeks for me? Would you let it out? Since we don't have a tongue depressor, we're gonna pretend this is a tongue depressor, and I'm gonna check for gag reflex, so open wide. Okay, she does have a gag reflex. I know that she can swallow because she can talk, but would you swallow for me? Okay, now would you cough for me? Okay, I know this patient can hear good based on the conversations we've been having. She's been answering all my questions right, but I'm still gonna do the rub fingering test. So would you look over there and would you close your eyes? So I'm gonna rub my fingers and you tell me, and you raise the hand where you think you hear it. Okay, her hearing is good. So I'm gonna check her ears. Her ears are equally bilateral. There's no swelling, there's no lumps, and the skin is intact. There's no lesions. I'm gonna check the inside for any redness, for any cerumen, for any lesions, and the opening is normal. Also, if she had cerumen, I would note the color and the amount. Same on this side, any redness, swelling, any lesions, and the opening is normal. Any cerumen, I don't see no cerumen, but again, the color and the amount. So now, her neck is erect in its midline. Would you do some range of motions for me? So would you go chin to chest? Now look up. Now do your ear to your shoulder. Ear to your shoulder. Now again chin to chest. Now look up. Now ear to shoulder. Ear to shoulder. Okay. This is again to check for any pain. Did you have any pain?
No.
Or any crepitus? I didn't feel anything. Now. I'm gonna check her nail beds. They're round and smooth. Her capillary refill is it's a 2. And her capillary refill is a 2 on this one, which is good. It should be the capillary refill should be less than 2. Her skin is warm to touch. There's no her pigmentation is even according to her genetic background. There's no patches and the skin is dry, as in there's no diaphoresis, and it's warm to touch. So, do you have any wounds?
No.
Okay, and if she did have any wounds, I will document the location, size, and exit date, which is the color or the odor, I'm sorry. And do you have any lesions?
No.
And if she had any lesions, I would notate the asymmetry, border, color variation, diameter, and elevation. So now I'm gonna inspect for edema. So on the extremities, she has she don't have any edema, but if she did, I would rate it from 1 to 4. 1 plus being mild pitting, 2 plus being moderate pitting, 3 plus being deep pitting, and 4 plus being very deep pitting. So now I'm gonna go ahead and do the Glasgow Coma scale. So her eyes are responsive spontaneously, so I would give that a 4. Her verbal response is oriented to person, time, and place, so I'll give it a 5. And her mobility, she's able to follow commands, so I'll give her a 6, and that gives me a total score of 15. Also, I would do the signs of stroke, the FAST acronym. So I would see face drooping, arm weakness, slurred speech, and if I see all of those, it's time to call 911. So now I'm gonna go ahead and do the perfusion part of it. So I'm gonna check for jugular vein distension. So would you look that way for me, please? There's not any, would you look that way? Okay, now I'm gonna palpate the carotid artery, one at a time. First one here, and here. Now I'm gonna auscultate the carotid artery for any bruit. So what I'm gonna have my patient do is breathe in and breathe out and hold it whenever you feel it, okay? Okay, now I start at the jawline, at the angle of the jawline, and then at the midline. Okay, now at the base of the neck, at the base. And now we did it bilaterally. Also, something that I forgot to do with her ears, I will palpate the mastoid process. Push on the tragus and pull on the pinna, and same on this side. Push on the tragus and pull on the pinna. So now that I auscultated her carotid arteries, and I will do it bilaterally, I'm gonna grade her pulses from 1 to 3, 0 being absent, 1 being weak, 2 being normal, and 3 being full bounding, and I will do it bilaterally. So I'm first gonna start with my radial. I say it's a 2. I would say it's a 2. And the other, I would say it's 2. Now the ulnar, it's a 2. It's a 2. The brachial, it's a 2 as well. Brachial is a 2 as well. This one, it's a 2. Now the apical is you go to the angle of Louis, 15 intercostal space, and then mid-clavicle line, and it's a 2. Now I'm gonna do the popliteal, which is right here under the knee. So this one's a 1. This one's a 1. Now I'm gonna do the dorsalis pedis, which is on the top of the foot. So I would say it's a 2. I would say it's a 2. Now the posterior tibialis is on the by the ankle. So this one's a 1. And this one's a 1 as well. So now I'm gonna look for in the extremities. I already said her. I will palpate for any tenderness. I already said that her skin color is normal with her genetic background. I will also know any the hair growth, and I already said that her skin was warm to touch. Now I'm gonna look any over any positions of the main areas. So it's the pulmonic, aortic, ERS, tricuspid, and matrial, and I'm also gonna auscultate. So pulmonic, no, I'm sorry, aortic, pulmonic, ERS, tricuspid, and matrial. Okay, so now I'm gonna go ahead and go to the gas exchange part of the checkoff. I already said that her capillary refill was less than 2. Okay, so I'm gonna listen to her lungs, and I'm gonna do it on the A spot. So you start from left to right, so it goes doom doom, here here, and then here, and then here. And I want to listen to see if she has any abnormal lung sounds like wheezing, crackles, or anything like that. And I will listen to a full respiratory cycle. So breathe in and breathe out. 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 And breathe in and breathe out. Okay, now I'm gonna do it on the posterior part, which is over the 8 landmarks as well. So breathe in and breathe out. 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 And breathe in and breathe out. So now that you're standing up, I'll check the chest expansion. So you put it at T10, and you pinch a little of her skin. And would you breathe in and breathe out? And this is just to check the symmetry, and it should go like this, and it did. Also, I'm gonna check the tactile firmity. So this is just to feel the vibration. So say 99.
99.
Say 99.
99. 99. 99. 99. 99.
Okay, so if I wouldn't feel the vibration the same, that could mean any blockage or anything like that. Also, I'm gonna do the costovertebral percussion, and this is just on the rib 12, and I'm gonna percuss to check for any kidney tenderness, any problems, any masses. So also, I already said her breathing pattern and her chest is a 1:2 ratio. So it's normal. Barrel chest is gonna be 2:2 ratio. Pectus excavatum is the sternum is sunken in, and pectus cranium is the pectus bulging out. And I think that's it. Thank you. I'll take off my glove.